attorney here in the Salt Lake City office for Holland and Hart. And joining me for this presentation is Mikel Jimenez, who's a labor and employment specialist attorney in our Salt Lake City office. As you're all aware, we're going to be spending about an hour going over some of the best practices and how to comply with federal and state recommendations for reopening your business under the new COVID-19 recommendations that are out there. So it is navigating a new normal, and it's very strange for everybody, but based upon our experience and based upon our analysis, we're going to go through and give you the best advice that we can for how to reopen up your business, to mitigate risk to yourselves and to any customers that may be in your businesses. The format for today's meeting, I'm going to have Mikel Jimenez is going to go ahead and spend the first 25 minutes talking about issues that are relevant for all employers and all businesses. And then I'll spend the next 25 minutes speaking about issues that are specific to healthcare practices and healthcare entities. And thereafter, we'll leave about 10 minutes at the end is what we're hoping to answer any questions. So please, as we're going through the discussion, if you want to go ahead and post questions, we'll be looking at those and then trying to answer as many of those as we can at the end of the webinar. So thanks for joining us, everybody. With that, I'm going to turn the time over to Mikel.
Good morning, everyone. Thank you so much for joining us today, and thank you, Christy, for that introduction. We are learning to navigate the new normal, and I wish I could tell you with confidence that the new normal today will be the new normal even this afternoon or next week, but I think the biggest takeaway for my point of view for employers today is to remain nimble and flexible and ready to pivot and shift at a moment's notice, because that's what we're all doing right now. Of course, this is a presentation and is not a substitute for legal advice, but we're happy to connect with any of you about specific legal issues that you have. So as Christy indicated, I'm going to start off today by talking about some of the information that is applicable to all employers as we reopen our businesses and rejoin the community and our economy opens up. There is so much information out there between the White House and the CDC and OSHA and the FDA and the EEOC and state governor's offices and local health departments that it can be very overwhelming, not just to employers in general, but even to those of us who spend our days and nights trying to remain experts in this field. And so what we've attempted to do today is to cull through that and provide you some really relevant and helpful information. And there's so much that you'll see there in the slides. There are a lot of links to helpful resources and additional resources that you can look at. But in my view, the way I see this for employers is a two-part process. One is helping to communicate and message to employees that they have a real personal stake and personal responsibility in helping the employer reopen and maintaining a safe workplace so that there is a business to continue to report to work to every day. Some of the hallmarks of that personal responsibility that employers should be messaging to employees is wearing masks, cleaning and disinfecting the things that you touch, washing your hands often. A lot of this may sound familiar to you employers that you heard in the beginning of March when you were starting to put in place some precautionary measures as the data started to emerge about COVID-19. That guidance has not changed. So things like washing your hands often with soap and water for at least 20 seconds, using hand sanitizers with at least 60% alcohol if soap and water is not available, and if you can get your hands on hand sanitizer. Those remain important. Avoiding touching your eyes, your nose, and your mouth with unwashed hands. Wearing masks and, if necessary or possible, gloves in the workplace is a really good way to put that precautionary reminder in place. Covering your mouth and nose with a tissue when you cough or sneeze, or using the inside of your elbow. Cleaning and disinfecting frequently touched objects and surfaces in the workplace, and we'll talk about that in more detail. And avoiding using and sharing other people's items such as phones or desks or offices, or even sharing pens and pencils. You may have to get rid of that community tray where all the pens and pencils get thrown in the office supply room for now. And also, importantly, continuing to practice social distancing. We've all had enough of being cooped up inside our homes and away from each other, but social distancing is going to remain an important hallmark of reopening the workplace. The other component of this is the employer's responsibility. It's a lot to take in, but workplace responsibility starts with looking at state-specific requirements. You may have seen that the White House issued some guidance that in large part the federal government is deferring to the state governments and local health departments to advise their own citizens how to reopen. So be up to date on state-specific requirements. I know that many of you may be Utah companies, but many of you may be outside of the state of Utah. There's a link in here to an example that our government, our local government, that has put out that may or may not apply to your workplace, but we thought it was a very good example because it very succinctly shows and identifies who are the high-risk individuals, what are the hierarchy of controls that you need to put in place, and then this great checklist of things that you can look at as you are putting in place measures to reopen. So you can click on that example and see that if you need to. You need a plan, and it should be a written plan, and it needs to be flexible, and it should include a mitigation plan for the risk of resurgence. We know that this didn't go away on May 1st when a lot of the restrictions were relaxed, and it's not going to go away anytime soon. So having a mitigation plan is also essential. Protecting the most vulnerable is going to remain very important as well. That guidance has not changed much. That means individuals over the age of 65, those who live in nursing homes or long-term care facilities, people with chronic lung disease or moderate to severe asthma, serious heart conditions, and other vulnerable populations that have been identified by the CDC and your local health department. Providing reminders. It remains a very good business practice to place posters at different frequently trafficked places about staying home when sick, proper cough and sneeze etiquette, proper hand hygiene, putting that at the entrance that employees use to come into the workplace, putting it where employees clock in and clock out for the day, in the break room if you're going to allow a break room to be used right now. If you have an area where employees may be changing in and out of PPE or other uniforms for work, putting those posters up so that you have frequent reminders. Again, we have links in here to some really great posters that the CDC has created, and they offer them in both English and Spanish, so they do the work for you. So you develop a plan. What does that plan need to include? It should first and foremost identify a COVID-19 workplace coordinator. As I indicated, there's so much information from so many different authoritarian agencies out there. It is a very good idea and a recommended best practice to identify one individual within your company that's going to take in that information and prepare it in a way that works for your particular workplace, and say it in a way that is easily digestible by your employees and that they can follow. So putting that person in place. Your plan should follow CDC guidelines, OSHA guidelines. The EEOC, the Equal Employment Opportunity Commission, has made very clear that during the COVID-19 pandemic that none of the employment laws, federal employment laws that govern employers, are intended to interfere with an employer's ability and need to follow CDC guidelines, OSHA guidelines, and state requirements. Look at your leave policies, and they may need to be updated. You may have found yourself in a position at the beginning of all this where you were an employer with 500 or fewer employees, and you suddenly had to modify your leave policies to comply with the Families First Coronavirus Response Act. That is still in effect. But even if you're not one of those employers, you want to look at your leave policies so that you have modified them in a way that fits the current situation, that is not punitive to employees who might need to take time off because they have symptoms or they are sick, because the last thing we want are sick people coming into the workplace and causing an outbreak or causing another shutdown of your place of business. So looking at and updating those leave policies. Consider screening. Screening is also allowed under the relaxed ADA guidelines, and what that can include is setting up a station that is separate from other employees and can be confidential and private at the end or at the beginning of the workday, where you are allowed to take the body temperature of an employee. You are allowed to ask them if they have or have had COVID-19 or if they are exhibiting symptoms. If they have or are exhibiting those symptoms, there's another protocol that we will look at, but you want to maintain that as a private space so that other employees don't hear it, and you want to maintain that information in the employee's private, separate private and confidential medical file. You want to create or update any emergency community response plan. Continue offering remote work where possible so we have a phased and slow reentry back into the workplace. Consider what kind of PPE is appropriate in your workplace. Masks are a must, particularly where social distancing may not be feasible in all situations. Also, continuing to eliminate unnecessary travel, meetings, conferences, workshops, and training sessions where possible. So here I've provided you with a tool that you can look at workplace mitigation strategies that you might employ and incorporate into your plan, depending on whether or not you have minimal risk, minimal to moderate risk, or substantial risk of infection, or you've had an outbreak in your workplace. So I won't go over that in detail because we have limited time today, but that's a very useful tool to help you figure out not only the plan you're going to put in place now, but as you have to continue to modify your plan. Here are some other reopening considerations that need to be included in your plan. And I do suggest that within your reopening plan, you have a separate written cleaning plan that is easily digestible and can be placed at different places around the workplace. The first thing you want to do is look at the types of surfaces that are in your business. And that becomes important. We'll see why in just a moment. Do you have hard surfaces or porous surfaces? You probably have a combination of both. The reason for that is the EPA has provided a list of approved cleaners, depending on whether or not you're cleaning a hard surface or a porous surface. And the link is there so that you can look. There are over 400 approved cleaners for hard surfaces and a very limited number of approved cleaners for porous surfaces. You want to make sure, if you can, get your hands on one of those approved cleaners, that you do, and that you have a sufficient amount of it so that you can engage in the continual cleaning. Any cleaning process is a three-step process, and it always starts with soap and water cleaning of any surface. Then you move in number 2 to the disinfectant cleaning directions. You want to follow the label, and you want to also make sure you provide proper training depending on the kind of chemical. We recognize that many disinfectants and cleaners are simply not available right now. So the CDC has put out a guidance that says instead you may use 1/3 cup of bleach to 1 gallon of water or 70% alcohol solutions. But be very careful if you're doing this not to mix solutions, because if you mix cleaning solutions, the fumes can be dangerous to people who are breathing them in. It can be dangerous to people's skin. So either you need to use the one cleaning disinfectant that you can get your hands on and follow the label, or this alternative that the CDC has put out, but not both. You also want to make sure you have proper cleaning PPE for the individuals who are performing the cleaning, so proper gloves and masks and protective eyewear if necessary. The next thing you want to look at are the kinds of areas, high traffic areas, medium traffic areas, and low traffic areas within your workplace. So I've provided here a list of different high traffic areas that need to be cleaned at each use. So things like doorknobs and light switches that are used often, countertops, handles, ATMs, shopping carts if you're a marketplace, POS pads. If you have a place where your employees clock in and clock out and they all use the same screen, that needs to be wiped down after each use. Again, this may be an opportunity to harness the COVID-19 coordinator position that you create and have some individuals that work under them that are responsible for that type of cleaning and monitoring. Next, you want to look at other areas within your workplace that may not require that every use cleaning, but may need some more spaced out cleaning. So do you have outdoor areas? There is no need, according to the CDC at this time, to disinfect spaces such as sidewalks. There's no data that suggests that that reduces the spread or exposure to COVID-19. But you may outside have hard surfaces such as tables or chairs or other kinds of fixtures and improvements that would need to be evaluated to see whether or not they're high traffic areas and need to be cleaned after each use, or they're medium traffic area that maybe they are cleaned every 30 minutes. Or once a day or overnight. You also want to be mindful if you have areas that are used by children. If you have surfaces or things that are used by children, the CDC recommends that only soap and water be used to clean those items because the disinfectants and chemicals can be very dangerous to children that might put them in their mouths or put their hands on them and put their hands in their mouths. So making sure you have a plan for how and when you're going to clean the areas within your business and what you're going to use. So we've also provided here several links to resources that you can look at because, again, the new normal is going to be something that's going to evolve and change. So Holland & Hart has put together a coronavirus resource site. We did this at the beginning before, I think even before at the time it became a pandemic. So we have the guidance that was issued at the beginning and we've updated that along the way so you can go back and look at different questions you might have. The White House also put out its guidelines for reopening recently. That's the second bullet point there. Again, they're largely deferring to the states, but it talked about this idea that there would be a 14-day decrease in numbers of cases and numbers of hospitalizations and having testing in place and putting some community tracing in place. And you can look through that and see the three-step process and the way they've organized it. And there might be helpful tools in there that you want to incorporate into your business. Different states also are issuing guidelines, and so are some counties for reopening. There's a link to the Utah example, which we think is a very good example, but my guess is whatever state you're doing business in is going to or will soon have an example of what the guidelines are for that state. In Utah, for example, we've now moved into this orange phase where instead of limiting gatherings to 10 or less, it's 20 or less, but still keeping in place the use of masks and mandating the use of masks and using social distancing and the types of precautions that need to be put in place depending on the kind of business that you're operating. There's a link to the different CDC resources, OSHA resources, and EEOC guidances that, again, changed. There was a release yesterday by the EEOC, and literally within hours they had to take it back because they realized it had been misinterpreted. So checking those resources often. So let's talk for a minute now about what you do if an employee is suspected to have COVID-19, if you've got this screening process in place and this comes up. We have a detailed checklist on our resource website, but a few hallmarks to think about. Refer to the CDC guidance on cleaning and disinfecting areas of potential COVID-19 exposure. Depending on what's occurred and how widespread the exposure is, you may actually need to shut down a facility for a 24-hour period or a period of time to have a certain kind of cleaning performed. You will immediately want to investigate with that employee who they've come into contact with, where they've worked within your facility, and who was on schedule and working at that time. You will then need to notify employees. You do not want to use the employee's name. You want to keep that confidential and all of the information that you obtain about their symptoms in their separate confidential medical file. You may need to modify staffing. If there are individuals who have COVID-19 or exposed, you're going to put them on the 14-day quarantine. We're going to require a negative COVID-19 test result before they return to work. But there may be others who have been exposed that you may need to look at putting on some sort of a quarantine or a symptom watch list and so you might have to modify your staffing. I do suggest having some different modified staffing schedules available for you to choose from so that you're not trying to create that on a moment's notice. You also want to contact your local health department and partner with them. While you do not want to disclose the name of the employee who's infected to other employees, it is okay to disclose the name of that individual to the health department. There are a couple of helpful links here. There's a CDC risk assessment tool and some general guidance that can help you navigate if you find yourself in this situation. So let's very quickly, in the last 4 minutes that I have here, talk about navigating employees' rights under some of these laws. So again, the Equal Employment Opportunity Commission at eeoc.gov puts out a lot of continuing guidance to help employers navigate these laws. But a couple of the big ones, number one is the Americans with Disabilities Act. So we have a link to some consideration for employers during the reopening phase that we put on a Holland and Hart client alert. You can link to it right here. One of the things that is very important and that I stress again is that the Department of Labor and the EEOC have made it abundantly clear that none of the federal employment laws that are in place are designed to interfere with an employer's ability to comply with CDC guidance or with federal, state, or local laws to help stop the spread of the COVID-19 pandemic. So in that regard, whereas typically pre-pandemic conditions, you would not be allowed to take the body temperature of an employee without jumping through many hoops because that would be considered a medical examination under the ADA. There is a relaxed guidance here that allows you to do that because using the language of the ADA, it is an illness that can cause serious bodily injury and is a direct threat. And so making that determination, you can take the body temperature, you can ask about symptoms, you can require a negative test before an employee returns to work, you can require a doctor's note before an employee is allowed to return to work. One thing that's also been made clear is that you need to continue to engage in the interactive process in terms of reasonable accommodations that may be requested by employees. There is a lot of requests for reasonable accommodation during the COVID-19 pandemic because we have some individuals who are members of vulnerable populations that may need to work remote or may need to have more than 6 feet of social distance because they have underlying asthma conditions, they have underlying heart conditions, they have a suppressed immune system. And so you want to continue to engage in that interactive process, but what has changed significantly is the interactive process is, in short, where the employer has to evaluate whether or not there is a reasonable accommodation that can be made. And that doesn't have to be the accommodation that the employee asks, it's the reasonable accommodation that the employer can offer. And that has to be balanced up against whether or not that accommodation poses an undue hardship to the company. And right now, undue hardship has taken on more significant meaning so that things that would have almost never been an undue hardship to a company pre-pandemic are now. And the reason for that is the sudden loss of income streams or the sudden closure of businesses or the inability to provide enough hours for employees so that you could move an employee out of maybe a face-to-face interaction with a patient or a client or a customer and put them in a back office to do work because you just don't have that work. So many of those undue hardships that wouldn't have allowed you to deny a reasonable accommodation before the pandemic now do qualify as a basis if you truly cannot provide an accommodation. The other big thing that's come out of this is that the reasonable accommodation process, that interactive process, if you need to provide a temporary accommodation, you can do so. But you want to make very clear to the employee this doesn't displace your interactive process or the reasonable accommodations you would typically make, and that it's a temporary accommodation, and that as guidance changes and the regulations change, so may the accommodation. There was a release yesterday that said the EEOC said it was okay to ban certain individuals from the workplace, I will tell you they took that down from their website quickly and are reissuing that guidance. So be careful of that. Very quickly, you'll want to be mindful of OSHA. That's providing safe workplaces. I will tell you that the mere existence of COVID-19 is not sufficient for an employee to refuse to come to work. But you do want to remember your vulnerable populations because they may have different needs. But if somebody says to you, I'm refusing to work because I'm afraid of COVID-19, while we can be sympathetic to that, that is not an OSHA violation. That is not a reason for not coming to work. What you can do, and what I've worked with a lot of my clients on doing, is offering the employee potentially the right to take some accrued but unused paid leave, or if your company does not have a paid leave policy, to take unpaid leave. But being mindful of not jumping straight to termination if an employee is refusing to work or demanding, an N95 mask when those are in very short supply, because they do have the right to make those kinds of protestations. And that takes me sort of to the last part of this, which is the National Labor Relations Act. I mention that only because employees are protected in coming together in concerted activity to complain about working conditions and improve those working conditions. The reason I bring that up is that many employees and employers are under the false impression that the MLRA only applies to unions and companies that have unions, and that is not the case. It applies in any instance where 2 or more employees come together to complain about their working conditions. There are a few other things to consider here. We've talked a bit about the FFCRA, and we've given you some good links. And I do want to end on a positive note. Innovation is a key, and I've worked with a lot of my companies to innovate their business purpose at this time, to get creative about expanding the services they offer or pivoting and using existing resources. I have a fine dining restaurant client that is now fully up and running with an app and engaged in curbside pickup and takeout, something they never would have imagined prior to the pandemic. I have another client that now is manufacturing plastic face shield masks and really trying to deploy those and get them out to healthcare workers and frontline workers. Connecting with workers is something that should not go away post-pandemic. It's a really effective tool, and keeping those communications. That's all that I have, and I'm going to turn the time over to Christine. I know we have some time for Q&A at the end.
Thanks, Mikkel. That was incredibly helpful, and I think all of those points that you've made and what you've covered applies obviously to all employers and all businesses. So with that being said, I now want to turn the focus to healthcare-specific businesses, so healthcare providers, whether that's physician practices, surgical centers, hospitals, anybody that's in the healthcare industry. And there's so many considerations for healthcare providers. I want to be clear that most of the topics we're going to discuss today were included in a client alert that was published on Monday on our website. And so please refer to that client alert for additional information and additional links that aren't included on this slide deck. And that was done by Lisa Carlson, one of our attorneys that's a healthcare specialist. So moving to the next slide. The first thing you've got to realize, and I think everybody's clearly aware of this, but you've got to make sure that you're not resuming care, or that how you're resuming care is done specifically with your state and county orders. So make sure to monitor those, and I do expect that those will change and fluctuate as we see different surges. We're watching very closely in Utah at our numbers right now. I think there's a little bit of a surge, so it'll be interesting. But you've just got to make sure this is not a static situation, of course. I think everybody realizes that. So you've got to stay on top of those state and local orders. Also make sure that while we've got national guidance in place from like the CDC and then very specific industry groups about how to resume care and precautions to take, some states and some counties have very specific requirements. For example, the governor's order here in Utah included something interesting that says that all magazines or toys in the waiting room need to be removed, which is a great suggestion, right? We don't want people to be touching things if they don't need to be. So make sure to look at your local and state orders for the specific requirements and then review those ongoing throughout this crisis. Make sure as you're resuming care that you're coordinating with public health officials and other care providers that are going to be needed in relationship to the care that you are going to be providing to patients. So, for example, if you're going to be resuming, let's say that you're doing endoscopies, colonoscopies, and obviously those haven't, unless they were, incredibly urgent and fell in the CDC's, requirement for being done earlier, those were on hold for a while. So let's say you're resuming those. You've got to be looking at, thinking very carefully through all the steps that your patients are going to have to take with whatever care you're providing, whether that's before they come in, dealing with pharmacy, imaging, pathology, and post-acute care is going to be really important. And so you've got to plan the entire spectrum of care, even if it's not your specific area of care that you're going to be providing, to make sure that that will be available for the patient and that there's a plan in place to mitigate the risk to that patient. For example, with post-acute care, if you're going to be doing a procedure where post-acute care may be needed, right now, obviously, there are increased risks, let's say at skilled nursing facilities, rehab hospitals. And so to the extent that you can plan this and make sure that we're reducing the chance that patients will have to have post-acute care in a facility. We should be planning for that and reducing that. And then also, where we can do home health care if possible, make sure discharging patients to home where that's appropriate. There's got to be a lot more careful planning than there was before. Last on this slide is just be prepared to decrease or stop non-essential medical treatment in the event of a COVID-19 surge. The whole purpose is that we're trying to mitigate risk to the public, to patients, to staff, and then we're also trying to obviously make sure that we have enough PPE, personal protective equipment, and enough care for patients that do get COVID-19. So as we're seeing surges, you may have to decrease or even stop some of this non-essential medical treatment if a surge occurs. Moving on to the next slide. So when we're resuming care, one of the first things to think about after we make sure that we have covered our bases with our state and local orders is patient management. As you're moving into providing care to patients, you need to be prioritizing the provision of care based upon medical necessity. So, for example, hospitals, surgical centers, they're looking very specifically at these high complexity disease management and surgical procedures that has been deferred, that needs to be done because it could result in increased morbidity or mortality. And those should be prioritized as the first cases and the first types of patients that you're getting in to be seen, because of course they need the care more than other patients. So make sure to have a plan in place where you're prioritizing, and make sure that you have those policies that are consistent and transparent, so that there's no preferential treatment being given to some patients, but that you're following a standard protocol for getting in those patients with the most acute needs. In terms of surgeries, they suggest, if you look at the CDC recommendations, starting with patients who have lower comorbidities and surgical risks, and again with procedures that are lower risk for airborne transmission or unintended hospital admissions. And again, those are just, if these are surgeries that we're not concerned about having to be done immediately because of risks of morbidity or mortality, if we delay them any further, as you're going through that list, make sure, again, that you're looking at these things so that you can get the proper patients in and mitigate risks. Utilize telehealth when appropriate. I think everybody's seen this mass surge in telehealth. Right now that the federal government is being lenient in terms of enforcement on the types of telehealth modalities that are used, but you should, where possible, of course, try and ensure that they are HIPAA compliant. You should be executing business associate agreements with those vendors, but continue to use telehealth when appropriate. As Mikhail talked about it with general employers, with healthcare practitioners, you should be implementing non-COVID care zones where possible. So where you segment out the care where you've got, kind of non-COVID patients, and then if there's suspected COVID patients that you should be caring for, where those are segmented into different rooms, different areas. Make sure that you're screening patients for those COVID-19 risk factors prior to in-person appointments. The CDC has a patient screening guide that's available for both when patients are making their appointments and then on the day of the appointment to appropriately screen patients. For surgeries, procedures, I think you're seeing pretty universally where testing is available, that patients are being required to get COVID-19 testing within about 72 hours of their test, and then they have to self-quarantine for the duration until they have their procedures. So a lot of this depends, again, on the availability of testing, but to the extent that it's available, you should be doing that, especially for surgeries, and then also for high-risk in-person appointments where available. Make sure that you're triaging your COVID-19 symptomatic patients, so you have a protocol in place that if a patient should arrive on the premises and you quickly do the screening and they have COVID-19 symptoms, make sure that you have a very specific triage protocol to get them out of the way from other potential patients, from other potential staff. Make sure to isolate them. Train staff on communicating with patients about COVID-19 and the related safety protocols. It's just incredibly important right now where patients are scared or they're confused. We need to make sure that we have staff that can really effectively communicate with patients and make them feel comfortable and clear on what they need to do. Make sure to adjust the standard of care if necessary. You should be looking at the CDC and community recommendations to ensure it's consistent with applicable standards in terms of when you should be rendering care and not rendering care during this time. The last thing on the slide is consider updating patient consent forms. I really think everybody needs to update their patient consent forms if you're going to be providing care at all during this time. For some medical treatments, for most, COVID-19 is going to pose a risk with patients that come in to get any kind of medical care. So updating your informed consent and having patients sign that before they come in so that they're consenting to that increased risk is going to be imperative to protect you as the provider. Next slide. The next we're going to talk about is infection control on the premises. And some of the things that Mikkel talked about are applicable here. But just in general, again, make sure that you're modifying the premises where possible to optimize social distancing. So modifying reception areas, patient waiting areas, entrance and exits, traffic patterns to maximize distancing afforded to patients and staff. I've seen, some emails from, certain providers like, plastic surgeons where they're telling patients that they're to call or text staff when they arrive and they're being escorted, straight into a room. So they'll have no interaction with any other staff or any other patients. So think about things that you can do to limit that interaction of patients with other patients and staff. Maintain low patient volumes. In order to optimize social distancing, we're going to have lower patient volumes. So you've got to stagger your appointments in a better way to have that happen. But also you've got to leave enough time in between patient appointments to thoroughly sanitize the rooms and equipment. Prohibit visitors. Now, some of this is going to be required by state or local orders, but right now, if it's not required, it is best practice that where possible, have patients come alone, unaccompanied, and only have one person accompanying them, adult, when necessary for their procedures, and have protocols in place as to how that's going to be allowed so that people are clear about that before they arrive. Implement robust cleaning and disinfecting protocols. As Mikkel mentioned, most healthcare offices have got great cleaning in place, but it wasn't something that you were doing in between every patient, and that really needs to be done now. So make sure that you've got a process in place for that. Monitor staff and patients for adherence to respiratory and hand hygiene etiquette. Again, we've given you links to posters that you can be printed and put in your office, and make sure that there are plenty of reminders for patients. There should be supplies, including alcohol-based hand rubs, sanitizer, and face masks available in your office for use of patients. If you can, install a physical barrier at reception areas. If you can't, like for example in Utah, while they want that barrier, if possible, if not, you need to make sure that your reception staff, that everybody in your office is wearing appropriate, PPE according to what they're doing in your office. But for reception, that would certainly include a face mask. And for more detailed information, make sure to see the CDC guidelines. They go in and for all sorts of detailed healthcare providers talk about what you should be doing to mitigate infection control. Next slide. So in terms of personal protective equipment, make sure again that you're requiring staff to wear face masks at all times. And then for procedures that have a higher risk of aerosol transmission, you need to make sure those are done with precautions and with thinking about the risk of transmission, such as using face shields or N95 respirators. Require patients to wear a cloth face covering or face mask at the minimum. The exceptions to that would be if you've got patients that are under 2 years of age, patients with trouble breathing, or incapacitated patients that can't remove the mask by themselves. You need to retrain staff on appropriate selection and use of PPE because it's such a unique situation. They've got to have some additional training about this. And then also just be thinking about conserving PPE. So due to this ongoing supply issue, everybody needs to make sure they're making every effort to conserve PPE that's consistent with the recommendations by the CDC on supply optimization, which we've got a link to on our slides. Next slide, please. In terms of healthcare and facility staffing, you need to be screening your staff very carefully, of course, for symptoms and potential exposure. As I think has already been mentioned, the CDC has a very good risk assessment guide that you can utilize for your healthcare staff, and you should be implementing these screening protocols consistent with the guidance published by the EEOC. Prioritize testing for healthcare providers. Staff with suspected COVID-19 should be prioritized for testing. So if you've got healthcare staff that are going to be working in capacities where they are going to be a higher risk for COVID-19 or they have suspected, they should be given the priority for testing. You should, though, remain mindful of HIPAA in regard to disclosures relating to testing. So make sure that you look at our guidance for more information on that topic. And make sure that you're implementing return to work requirements. You can utilize the CDC's return to work criteria for confirmed or suspected COVID-19 illnesses. In the healthcare space, return to work criteria is a little bit different than other employees. So make sure to look at that criteria and determine how you're going to ask employees to return after suspected or confirmed COVID-19. Implement or modify existing sick leave policies. So just make sure that you're looking at those, and those policies are flexible and non-punitive for staff to ensure compliance with public health guidance related to self-isolation. Reduce staff volumes in the facility. So to the extent that you can, and you're seeing this in the hospitals, in the surgical centers, for example, at certain points, you've only got the anesthesiologist in with the patient. Where it used to be that you would see, let's say, in a surgical, you'd have people that were in training, right? You would have students, you might have fellows, you might have a medical device rep in that room. Now we're trying to reduce staff as much as possible, obviously keeping within, making sure we can safely do the procedures. But if someone doesn't need to be in the room, they shouldn't be in the room, and they should only be in the room as long as they need to be in the room. So in all aspects, just consider how to reduce staff volumes so that we don't have as many people that are at risk for being exposed. The other thing that I think is really important is identify your high risk versus low risk staff. We're seeing stories coming out of New York, of course, where you've had a lot of deaths among staff that were, let's say, security guards or people that worked in the basement of hospitals that were handing out PPE. They weren't interacting, they weren't supposed to be directly interacting with patients, But of course, there was a lot of exposure to them just on the basis of being in these areas that had COVID-19 positive patients. And so you need to make sure that you're looking at your high risk versus low risk staff. So your high risk, if they're over 65, have underlying health conditions, cardiovascular, hypertension, diabetes. If they're immunocompromised, you need to make sure that you're identifying those high-risk staff members, and to the extent that you can, accommodate them and assign them to low-risk tasks so that their level of exposure is lower. But make sure that, again, everybody, regardless of where they're working, has access and are wearing appropriate PPE. In terms of other considerations, just make sure to look at our resources on the Holland Heart website in terms of guidance for healthcare providers. Next slide, please. In terms of facility management, make sure that you're developing a plan for staffing shortages. Due to exposure or illness, or people that are working, they've got their kids out of school and there's a lack of even childcare. We've got issues with staffing. So make sure that you've got a plan for staffing shortages, and we've included a link to the CDC's recommendation for mitigating staff shortages. Ensure adequate equipment, medications, and supplies for operations. Again, we've got to be more carefully planning right now. So as you're considering doing procedures or any kind of care, you've got to think about making sure that you've got all the supplies, the PPE, the medications, that are available in a way that is not going to impact the community's ability to respond to a potential COVID-19 surge. So keep that in mind. Think about your insurance coverage if necessary. You may need to adjust your insurance coverage, or just make sure that how you're doing your business right now in terms of providing care, let's say via telehealth or modified ways that you're doing business, maybe that's doing some off-site screening. Make sure that your insurance is going to cover how you're operating under these new COVID-19 procedures. Keep in mind that the CMS, they have come out with a lot of new codes related to COVID-19 treatment and for telehealth. Right, because telehealth has been expanded significantly. You need to make sure that your billing and coding staff are up to date on these new codes so that they can bill properly. Review existing contracts. You want to take this time, I think, to look at your existing employment or independent contractor agreements to address things such as adjusted hours and compensation. I would recommend evaluating your vendor supplier contracts to ensure that they are implementing appropriate COVID-19 safeguards in the performance of their services. Maintain documentation related to COVID-19 relief funds. Many of you are getting funds from the federal government related to COVID-19, but there are requirements in terms of how you have to track those, so make sure that you are clear about those requirements and tracking them. And then monitor the status of federal and local regulatory waivers. Of course, the federal government has waived a lot of requirements. That CMS has waived a lot of those. You've seen the DEA waiving requirements, HHS, but also you've seen states doing the same as well. But sometimes the states do not line up with these federal waivers. So you need to make sure that you're really closely monitoring these federal and state waivers to make sure that what you're doing is appropriate and acceptable under both federal law and state law. And you've got to keep on top of that throughout the course of this pandemic, because these waivers will only be in effect during the course of the pandemic, and they will change. Next slide, please. One of the last things I want to mention is that there is industry-specific guidance, and we've included several of these links here, such as for ambulatory surgical centers, College of Surgeons, Plastic Surgeons, Dental Association. So please, for whatever area you're in, there is a lot of very specific guidance, so make sure to refer to that. Next slide. I wanted to make sure as well that you just remember that there's so much coming at all of us from all different directions. We are updating. We have a very specific Holland and Heart COVID-19 healthcare website, but also one just for general employers. but make sure that you're checking that. And usually if there's something you're looking for and you can't remember something that came out a week ago or 2 weeks ago, what's the status? We're trying to keep that very well compiled for all of you, and we even have state-specific information. So make sure to utilize that as a resource moving forward. And in terms of this slide deck, that is located on our health law blog. That's hhealthlawblog.com. Make sure to go to that and make sure you've got this slide deck, because we have embedded it with all of these links to the resources that you'll need to dive deeper. Next slide, please. So with that, we are finished up. We appreciate your time. Again, we know this is can be a scary, confusing time, and the bright spots that we're seeing so many clients that really are pivoting, and like Mikkel said, making lemonade out of lemons. And I've got just so many clients that are innovating, and we're seeing innovations happening at light speed that we would never see before. And I think some of those going into the future will really benefit everybody, including the healthcare industry, such as telemedicine. So I just encourage all of you to, I guess, keep hopeful, do your best. If you have any questions, we're here to help and guide you through this process. I don't see any questions that have been posted. Mikkel, do you see any?
Yeah, I see one. The question is, if a staff member goes on a previously planned vacation later this summer out of our state, should we have a policy about returning to work after travel? If we require them to quarantine after vacation, are we required to pay them or offer work from home? So that's a really good question. So in answer to the first question, should you have a policy about returning to work after travel? The answer is yes. And that policy can take a couple of forms. You can follow your screening procedures for report to work. So have them report, and you would want to make on your questionnaire for symptoms, you would also want to have as a part of that questionnaire, have you had travel, in the last 30 days? If so, to list where. But you can take the body temperature, ask about the symptoms, and the CDC did update its guidance a couple of weeks ago to say that if someone's not exhibiting symptoms, and I know this is contradictory to other guidance, so it is not lost on me, the irony and the contradiction that some of these guidances have. But basically, if someone's not exhibiting symptoms, even though people can be asymptomatic, that you can allow them to resume work. Another option is the one that you have indicated, which is requiring a self-quarantine. And in doing that, you could require a 14-day self-quarantine. You could require a 3-day self-quarantine where there's no use of any analgesics or medications that would prevent you from having a fever or other symptoms to see if those symptoms arise. So I say, yes, you have a policy, and I think you need to make it fit your needs, but be consistent with the kinds of screening that you do for people reporting to work. The second question is, if you require them to quarantine, are you required to pay them? There is no law that requires a blanket payment for required quarantine or self-quarantine. What you do need to look at is to determine whether or not your organization has to comply with the Families First Coronavirus Response Act, the FFCRA, because if so, then you may have to pay for 80 hours of leave under the emergency paid sick leave law. If at the time the individual has to quarantine, that law is still in effect. Or you may have to comply with the extended family medical leave provisions as well. So, but all of that is dependent on whether or not the FFCRA applies to your organization. In short, it applies to organizations with 500 or fewer employees. There are some rules around the way you count employees, and the timing of that is it's the number of employees you have at the time the leave request is made. So, and if you have more questions on that, I'd be happy to talk with you about it in more detail. And that's the only question I see in the Q&A. Let's see, where would you repeat where the slide deck is? I think Christy did repeat that.
Yeah, so with that, I think that we're finished, but if anybody has any specific questions, we encourage you to reach out. We're happy to answer those as we can. So thanks for joining, everybody, and good luck as you move to reopen your businesses during COVID-19.
Yes, thank you so much.
Take care.